So we're about 3 months plus into the COVID-19 pandemic, and there's still a lot we don't know about the virus. Testing is hard to come by in communities of color, and there's no cure. A number of drugs for treatment are in clinical trials, and we're at least a year away from a vaccine to prevent the spread. But one thing we do know is that the rates of infection and deaths among Blacks and Latinos and Native Americans are significantly higher than for their white counterparts, especially in densely populated cities like New York, Detroit, Milwaukee, New Orleans, and cities across the South. The COVID-19 crisis is revealing what we in public health have known for more than 30 years, that not only are there serious structural barriers to accessing healthcare for the Black and brown populations and low-income people, but chronic diseases and infectious diseases like COVID-19 disproportionately impact us. So today we'll hear from our experts, and our first guest is Dr. Georges Benjamin, who is currently the executive director of the American Public Health Association, the nation's leading public health association. He and I are going to talk a little bit about the recently released data that has uncovered some of this disproportionate impact of COVID-19 on African American communities. And then we'll hear from Dr. Angela Marshall, an internal medicine physician with a women's health practice. For over 25 years, she's been working in women's health, and who also happens to be the chair of the Black Women's Health Imperative Board of Directors. And then last but not least, we will hear from Ms. Shavon Arline-Bradley, who is not only a public health official, but an ordained minister. But let's welcome our first guest, Dr. Georges Benjamin. Georges, it's good to have you on the show. Thank you very much. Certainly appreciate it. I imagine these are slightly trying times for you. But let me just start with, how are you? How are you feeling?
I'm doing fine. Myself, the family, we're all locked in and doing okay. Challenging, worried about our friends and neighbors, but we're all right. And I know you're doing fine as well, I can tell. Smile.
I'm trying. I'm trying to maintain some balance. So before we get into sort of the hard questions, would you briefly just describe COVID-19 and what it is?
You know, it's a new virus. It's in the same family, interesting enough, of some of the viruses that cause the common cold, but this is obviously much more vicious. It's in the same family as MERS. That's the virus that folks would get from camels, and SARS virus that we got, SARS-1, which we got several years ago. But this one is much more infectious and obviously much more lethal. It is passed through personal contact. That means through respiratory spread, and we may even believe by aerosolization. But it comes from coughing and sneezing, breathing close enough to someone to get it into their nose and their mouth. It goes into their lungs, where it attaches and fundamentally attacks the lungs, causing a pneumonia-like disease. It can go to other organs and hurt other organs as well in a small subset of people. We know that about 80% of the people that get this do reasonably well. I mean, get a serious illness, but they're able to usually stay at home and take care of it. But for 15 to 20% of people, they get a very serious illness, ultimately going to the hospital in many cases, and many of those folks, as you know, died. Somewhere around March of this year, we first saw a report out of China that said that older folks, 60 and older, as well as people with chronic diseases, were more at risk, that if they got the disease, they were in that 15 to 20% category, or they didn't do as well. And obviously recognizing the fact that people of color often have a series of chronic diseases disproportionate to the white population. So diabetes, hypertension, heart disease, lung disease, would ultimately be more at risk. Coming a little bit forward, the health officer in Milwaukee began to notice this in her patients, that she was being seen a disproportionate number of cases in Milwaukee, Wisconsin, that were having this. And then we began to see it in New York, and then of course Louisiana and Detroit as examples, and of course out in California as well. So we now know, as we're beginning to demand the data, because we weren't getting the data early on about these disparities, that these disparities are real. They're not simply because they occurred coincidentally in African American communities. It is because the disparities, attack rates of this disease are real. And we think for many reasons, it's because folks do have chronic diseases, because they're publicly facing, and there's probably a whole range of the social determinants that play a role in this as well. So
just to be clear, there's no biologic or genetic determinant for this that you're aware of? Not that we're aware of. There's at this point, there's no evidence, although let me just say that we know this thing does go to a particular receptor that is, for some people that we treat hypertension. But most folks don't think, at least today, and every time I say something that I think I know, I always have to pull back a little bit. At least today, there's certainly no evidence that we are impacted because how we're born. Having said that, that was a rumor, that the opposite was true. There was this rumor and falsehood that we were immune. Let me just be clear, we're not. Right. Yes, we heard that early on, that if you were Black, you couldn't get COVID-19. Exactly. Okay. So would you talk a little bit about what APHA is doing? It is the nation's leading public health association. You've got members in every state, in practically every city. And so this has got to be a critical issue for them. They are really on the front lines of the public health response. What kinds of things are you doing? And what kinds of meetings are you being pulled into to talk about COVID-19? Well, we know absolutely this is a team activity to try to protect the public's health. And we've been working very collaboratively with many partners, including your organization, to advocate for additional funding for public health, for workers, in particular for surveillance systems. We've certainly been demanding that we get the data on race and ethnicity. I also was able to partner with the National Academy of Medicine. We're doing a series of webinars on COVID-19 to bring the science and the facts, since there's a lot of misinformation out there. And we're working a lot with media advocacy, talking to the media each and every day. And it seems like all day, every day, trying to get the message out about what's happening, what should we do, what should we do. And now, obviously, we're very worried about this reopening process and making sure that people are protected when that happens. And so I've got a question about that. A lot of talk about reopening. No real clear, I think, information about what that means and for which states. Governors, it sounds like, will make some of their own decisions. What kind of data are they going to be looking at in order to make those decisions? Well, that's a good question, because the White House put out a plan, which actually is not a bad global guidance. I'll say guidance. But it depends on what you do with that, because there are some entry points that require that you know what's going on in your community, that you have the data, that you understand on the clinical side who's infected, that your numbers are going down. But it also makes you need to know what the reservoir is. That means you need to know how many people out there that are infected. And because of the fact that we don't have enough testing going on, we don't know that. Just by the way, Texas just announced it was one of the states that is going to open, I believe, a week from today. And we'll see what happens. Obviously, everyone's going to open up slowly. But I'm hoping that they have the tools to know when to pause or step back a bit before we proceed, because at the end of the day, the population is going to be more impacted. And again, the population is more at risk will be the communities that are public facing and have more chronic disease, and that's communities of color. Okay, thank you. So just stand by. I want to bring in Dr. Angela Marshall, who is an internist, women's health specialist, who's literally on the front line here in this fight. As I said, she's a practicing physician of over 25 years and happens to be chair of the board of the Black Women's Health Imperative. But I'd love to hear from Angela and get her perspective. And for those of you who are watching and listening, there's an opportunity in the chat box to submit questions. At the end of this, we're going to take a few minutes and answer some of your questions. So as questions occur to you, as you think of things, please just jot them down, and we'll get to as many as we can at the end. Hi, Angela, how are you feeling?
Hi, doing well, all things considered. How about you?
I'm all things considered. So let me just sort of start with, I know you're still seeing patients, but you're doing it in a slightly different way. So could you talk to us about how you're seeing patients and what you're seeing when you have when you're talking to patients and you and your team are seeing them?
So we're seeing patients via telemedicine right now, just to minimize the risk of infection, not only to our staff, but to other patients. And we started that on March 17th, and it's actually been really effective. We also noticed when we started doing the telemedicine visits that there were so many people who had symptoms who couldn't get tested. And it was really frustrating because as a physician, I was calling around trying to find out where to send my patients to get tested, and I was getting a total runaround. And so, I understand that if I can't even figure it out, I'm sure that it had to be frustrating for the patients. It was very, very frustrating and disappointing.
So has that improved at all? Can patients now get tested when they want, or do they still need to have orders by a provider to get tested?
It has improved a great deal. So at least here in Maryland, they've set up several testing sites, and they've made it pretty easy for doctors to put the orders in through a central database. So that part has really improved, but it took a few weeks for that to happen. And I feel like we lost a lot of important ground during that time.
So, but if someone is asymptomatic, if they don't have any symptoms, at least that they're aware of, can they get tested, or do they still need their provider to make those arrangements for them?
Yeah, so they still need a doctor's order. And so as we know, everyone wants to get tested, but the reality is we do not have enough tests to go around. And I think some of the federal government messaging around that was a little confusing, because I think Pence said that everyone who wants a test can get a test. There simply are not enough tests. And so what we're doing is triaging people based on their symptoms and based on the need. The CDC has a great tool that people can use to see if they meet the criteria for testing. It's called the COVID self-checker. They just launched that a couple of weeks ago. And so anyone can go online, put in their symptoms, and it will tell you whether or not you meet the criteria for testing.
Okay, that's good. And it's on their website.
Yes.
Okay. So, you talk about a doctor or provider having to order a test. My concern is the many people out there who may be symptomatic, may not be, but who don't have a usual source of care. They don't have a doctor. What can they do?
Well, first of all, I think it's important for people who are sick to immediately assess, is this an emergency or is this life-threatening? And it can be a little tricky because many times anything related to your health is going to seem like an emergency to you. But we're talking about warning signs, things like chest pain, shortness of breath, dizziness, lightheadedness, altered consciousness. Any of those symptoms should warrant a visit to the emergency room, or quite frankly, calling 911. If the person's symptoms are manageable, you should hold from going to the emergency room so that they can focus on the sickest patients. Now, also, you want to avoid going to the emergency room if you don't need to, because if you don't have the COVID infection, you could actually become infected by going to a high-risk place like the emergency room. One thing I did want to point out to the viewers, particularly if there's anyone who doesn't have health insurance right now, is that you should never avoid going to the emergency room because you don't have health insurance. There's a federal law called the Emergency Medical Treatment and Labor Act, EMTALA for short, that requires all hospitals and emergency rooms to treat patients that are having health emergencies regardless of whether they have health insurance or not.
Okay, that's good to know. EMTALA.
That's right, EMTALA. That's a basic right here in America.
So you cannot be.
You cannot be turned away. They have to at least treat and stabilize you if you're having a health emergency, regardless of whether you have health insurance or not. Now, if the person is having symptoms that are not of an emergent nature, I think it's important to go to the CDC and check the COVID tester. At the end of that tool, it gives you how to contact your local health department, which is a great resource for anyone who doesn't have health insurance.
Okay. And we, obviously have an issue with some states that perhaps have not expanded Medicaid or not opening exchanges. There are some policy remedies that could be taken, that could take place. And so many of us are trying to work on those as well. But I'm concerned as, I read the news about some estimation of maybe 40-50% of patients who die at home suspected COVID-19, but could never get in to be tested. They even had symptoms, but it just didn't work. Is there anything one can do, if one has those symptoms, calls a doctor and the doctor says, well, you don't need to be tested. I mean, is there any recourse at all for patients or people who are having those kinds of symptoms who might be in that situation?
Well, again, I think if you're having emergency symptoms, the best thing to do is to go to the emergency room. If you're seeing a doctor and the doctor is declining to give you the COVID test, I think it's important to use the COVID self-checker ahead of time. So if you go through that tool and it says that you meet the criteria, it's very appropriate to consider saying something like, according to the CDC, I meet the criteria for testing. So why are you not testing me today? And I think that's an important way that we can advocate for our health, not just say, I want to be tested, because there are a lot of people who want to be tested that aren't Black or aren't, that can't be, we just don't have enough tests to test everybody. But I think when you can cite the facts and say, according to the CDC, I should be tested. So please tell me why I'm not being tested today. I think that's an important way that we can advocate for ourselves.
Yep. That might get someone's attention.
Exactly.
So one question before we transition, and I do absolutely want you to come back. Do you have, you're doing telemedicine, but of your colleagues who are still seeing patients in their offices, do they have enough personal protective equipment? Are you hearing any reports of?
That's a real problem. Most of my colleagues do not have PPE. We did not have PPE. We were doing testing early on. We had to kind of salvage and scramble and get PPE from other means, but it's a real problem. I have friends that are working in the emergency room that are reusing masks. I have friends that are anesthesiologists that are not properly protected, so it is a real problem.
Okay. Wow. Well, Angela, stand by. I want to now bring on Shavon, Arline-Bradley, and then we will have you all come back in just a few minutes. But we really thought it was important to have Shavon on because she is not only a public health official or a public health expert, she's also an ordained minister. And I really wanted to get her perspective on this issue, among many things, besides, combining public health and spiritual health. Shavon is the author of The Queen's Legacy, A Journey of the Trials and Triumphs of Phenomenal Women. And she, like Angela, is a phenomenal woman. But I think that aptly describes sort of what we're dealing with right now, Shavon. And I'm really excited to have you here. And so let me ask you, how are you doing?
Yeah, we are hunkered down. We have the new normal for many African-American mothers who are out there who are working from home and homeschooling children that they are not certified to do. And so thinking about my 6-year-old who just peeked in here because he wants to see all the Black women at the Black Women's Health Imperative, it has been a trial. One of the things that's important to know is I'm from New Jersey originally, and so I have family members who have tested positive. I've had family friends who have already lost their battle to the virus. And so it is a very taxing time, but glad to be connecting with you all today to talk a little bit about ways to really prepare yourselves spiritually, emotionally, but also physically.
Yeah. So as you sort of think about this from both a public health perspective and a spiritual perspective, I mean, we have this odd intersection, it would seem. What role can faith or any kind of spiritual or meditative practice play right now?
Yeah, that's a great question. I think, let me just start by saying this. Your faith and your practice is your own. So whatever religious practice you have or non-religious practice, every human body has a spiritual connection to something. And whether you believe in a deity or not, these are the times when your physical body reacts to the external environments. And so your faith is an amazing part of this journey. For those that do practice religious practice, this is the best time to find quiet time for prayer, quiet time for reading those books and those doctrines that you believe. I'm a Baptist minister, so for us, it's the Bible. It's devotional times. For my friends that are in the Jewish faith or the Muslim faith, following the Quran and following the Torah. But for those that do not have a religious practice, this is also time for quiet thinking, quiet spaces, deep breathing. And again, none of those practices are aligned with just one religion. It is also very important to tap into those places of hope. Hope is one of those things that we like to speak about as some spooky thing, but having hope actually allows you to think about greater things, to think about what it's to come. And I always tell people that when you find yourself in crisis, we know that particularly African-American culture has always believed in something greater than them and that's beyond them. That has allowed us to be resilient people for these centuries that we've been in this country.
Right. And I, would link this to health in that stress reduction, meditative practices can literally lower the amount of cortisol you have in your bloodstream.
Absolutely.
Which has true health benefits. And I would think in a situation where we might be bombarded with a virus, we want all the resources we can get.
We do. And we also want some of those positive endorphins that come through with your body when getting physical activity. That is all positive hormones that go through our body that actually helps us with our stress levels. And reducing stress helps reduce hypertension, helps reduce tension headaches, helps reduce heart rate, and it also allows your body to heal and sleep better. So those are all practices that we need to consider.
Okay. So I've noticed there's some memes circulating on social media encouraging us to use this time, find new hobbies, pick up new skills. So as a mom who is working from home and homeschooling, doing it successfully on all counts, I'm sure. What are your recommendations for how to use this time productively?
Yeah.
My concern is there are some, and women in particular, who will throw themselves into work, and I'm not sure that that's exactly the healthiest thing to do. So what are your thoughts and recommendations about how we can use this time?
Absolutely. I've been following all the social media. Yeah, all the social media banter about, skill up, level up, make yourself great. I saw one that actually helped me. Plan Bs have always been your plan A. Now make it happen. Now, for me, that was super helpful. And I think what most people are really trying to say is it is good in these crisis moments to tap into your talents, Tap into those passionate places that you really get time to be able to enjoy. So some tips are creating different schedules. You know, people say that teleworking is the best thing. I'm a business owner, so I work from home a lot. But what they've not realized is that working from home in a crisis means that everything piles on you and you begin to do more work. You have more stress. And so learn to create new schedules, scheduling cutoff times from your work, scheduling me time away from spouses, partners, and your children. For those that are in sandwich generation, some of you live with your parents because you're caring for them and have your children. Creating spaces and a lot of time where you know I'm able to check in here, but I need to check out here. Here's another thing, learning the word no again. Just because you're home 24/7 does not mean you have to answer every phone call. You used to be able to say, well, I was on the plane, so I couldn't answer. And we can't say that anymore, but you can still say no. Yeah, saying no is a part of it. But also another tip, balance your diet. Balance those times where you can actually now have to stock up. I mean, this idea of cooking at home all the time, not going out to eat, rationing your meals. I've been able to actually cook and planning my meals throughout the week. That has been a helpful tip for me. And then exercise. I will tell you this. I have a trainer, a sorority sister who's a trainer, and every Tuesday and Friday, she said, I know you don't have weights. I need you to get your, soup cans out of the pantry. And I've been doing weights with soup cans for the last 4 weeks. And it's made a major difference in my ability to function throughout the day. So if you can find time, create a new schedule, stick to that schedule, say no, but say yes to yourselves, I think you're going to be able to make it through this crisis.
Okay. I think we never miss by saying yes to ourselves.
That's right.
That self-care, that there is something to that. Absolutely.
Absolutely.
Well, thank you. I want to bring Georges back on and Angela back on. And while they're coming back on again, if you have questions, please, send them our way. I think we've got a few questions and I'm going to try to get to as many as I can. But while they're kind of coming back on, Shavon, as we think about what the new normal might be, what role can spiritual leaders play in helping us all sort of adjust to whatever this new normal is likely to be?
I think one of the things that we have enlisted, particularly clergy, those that are responsible for a large group of followers, parishioners, has been to stick with following the health guidelines. And then actually explaining the importance of being obedient as it relates to health practice. Our bodies are temples, our bodies are gifts. And so we want to sustain our gifts and be able to use them after this crisis. So in order to do that, to practice your faith leaders can give other options. We have some smaller churches that do phone calls and phone prayers. We have some that are doing, of course, technology and Zoom practices, and some larger churches that have technology have been able to do sermons. Also, utilizing the opportunities for phone trees, checking in on your membership. They would love to hear directly from the clergy leader or the pastor or the imam or the rabbi who is in leadership. It's really important that you're reaching out. I would say the last thing is this: never stop praying for those you care for. Continue to impart in them encouraging words, because guess what? For all my clergy leaders that are out there, you need prayer too. And so it takes all of us to be able to engage in these discussions to ensure that everyone's okay.
Thank you. So we've got a question in. Georges, this is for you. What are one or two things you'd like to see happen in our public health infrastructure that might mitigate the effects of COVID-19 and or help us prepare for the next pandemic?
I think the first thing we need to do is begin to, so right now we have two tools. We have education and physical distancing. So I always want to make sure that education is targeted to populations most at risk, for sure. So getting information out to communities of color, and particularly communities where English isn't the first language. Secondly, I'd like to see us protecting ourselves more out in the public, protecting ourselves and protecting our others. So when, the bus drivers and the grocery clerks, And the people that are public facing, they need our protection. So that means you need to wear your mask. That means you need to wash your hands. That means you need to do things that you can minimize your contact with them so you don't infect them. And if you're sick, don't go out, talk to your healthcare provider. We need to put the dollars into better training, staff, technology, so we can do the contact tracing. That's going to be absolutely essential for us to get our hands around this disease completely and keep it from under control, because we know that it's going to continue for some time.
So another question is, are masks now just a way of life?
They are for now. And look, I understand that as an African-American man, I'm going to wear a mask, but I'm going to be careful how I wear that mask going into a bank or any other place where I might put myself at risk. And
Right.
But I'm going to have my mask in my hand, and I will appropriately wear it. But you do have to think about that. There are some cultural issues, obviously, because we are at risk, and I don't want to get hurt, getting beat up or shot while Black wearing a mask. So those are things I understand we have to think about. But we can do that. Just some common sense on how you wear it. Put it on your forehead till you go to the store, then put it on. Make sure you're properly socially distanced and all those kinds of things that anybody grew up in the hood understands how to handle.
Yeah, it's too bad that we have to think about that, because that's for other people. That's not for us.
Well, our Hispanic brothers and sisters got to worry about that too.
Absolutely.
A question about drugs used to treat COVID-19. Remdesivir is under trials now, and the latest reports as of this morning were that it's promising. Can you talk a little bit about kind of where we are on our drug trials, and if there are any drugs available or soon to be available that might be helpful in treating COVID-19?
I think the most promising drug that I've seen so far is the remdesivir, and that is an antiviral that was used to treat Ebola and also was used to treat MERS before. I think we have to be careful about drug trials, because to do a drug trial properly, you really need to make sure that it's a randomized controlled trial. That means that in addition to having a treatment group, you have to have a control group. And so you could say we gave these patients this drug and they did better. That's not really scientific evidence. That's what we call anecdotal. And so we really need to do the proper trials to make sure that the benefit that we saw was from the drug and not from some other factor. And so I think we have to be cautious about recommending drugs. I know President Trump had recommended the chloroquine. That's not something that we could just start giving, because these drugs can sometimes cause side effects or can sometimes cause harm. So we have to be really careful about just rolling out drugs without doing the proper studies on them.
Right. We do have to compare those who have the drug and those who have the drug and see how they do. Can you talk a little bit just about any progress we're making toward a vaccine? I mean, I really think we're a year and a half away, but I just read yesterday there were some 60 trials underway. So I don't know how that's being organized.
Yeah, I think we're a long way away from the vaccine. I've seen that people have been doing the antibody donations and they've been treating people acutely with the antibodies, but the vaccines are a long way away, at least a year or more. So I think we can use this time as a community to start to educate ourselves about vaccines, because the reality is in our community, there's still about 36% of us that don't even take a flu shot. And so, we talked about this before, and that, many of us are uncomfortable with vaccines, and it's natural to feel uncomfortable about vaccines because it's a needle, it goes into your body and things like that. But I think we can use this time to really educate ourselves about how vaccines work and make sure that we're ready when the vaccine does come out, that we're ready to take the vaccine, because we're all going to need to do it for us to all benefit from it.
Would you give the website one more time for people to check for their symptoms? Because I think that's really good information if they're concerned to at least go into their provider, or if they have to go to the emergency department, armed with that information.
Absolutely. It's called the CDC COVID Self-Checker. You could just Google CDC Self-Checker and it comes up. And it's a great.
Thank you. Thank you. And on the Black Women's Health Imperative website, BWHI.org, there are resources. And if you go to coronavirus.bwhi.org, you'll see resources, strategies for sort of dealing with the coronavirus. Before I let you all go, and thank you so much for all of this. There's a lot of information, and it is hard to kind of cram it all into just a few minutes. But if each of you would just give sort of that one nugget that you want people to walk away with, that you want women to walk away with, to take to their families and friends, I would be enormously appreciative. And I just want to thank you, Angela Marshall, Georges Benjamin, Shavon, Arline-Bradley, for your time and for your wisdom. So, Angela, let's start with you. What is that one thing you need us to know?
Yeah, the message I would give to everyone is to use this as a time to really focus on your health. Coming up with a health plan, use this as an opportunity to optimize your health, because the reality is some of the people that are having the most difficult time with this COVID-19, they're having a hard time with it because of some of the underlying conditions that are not controlled, things like diabetes, hypertension, being overweight. So I think if nothing else comes of this, let's use this as a time to really focus on improving our health overall.
Thank you. Thank you. Georges?
I just want to remind people that we're all in this together. So please take care of yourself, take care of your family, but let me also ask you to take care of your neighbors. There are far too many people out there, particularly in our communities, that are by themselves, particularly those elderly folks that don't have anyone to check in on them. Even if you just can, pick up the phone and FaceTime Auntie Sue, your friend, your neighbor, is going to be very important.
Thank you. Shavon?
I would say that the end is not yet. If you are still living, if you are still breathing, that means you still have purpose. And I would encourage our community to remind ourselves of how resilient we are. We have seen crisis in our community for hundreds of years, and we still survive and thrive. And so I want all of our listeners to change their perspective. Let's change the way we speak about things. Let's be positive in our experiences. Let's engage our families. Let's mend relationships and know that tomorrow is coming. There's always sunshine on the other side of bad days. And I do think that we've learned a lot in this crisis and that we will survive. We're a great people, and we come from greatness. Let's continue that legacy and teach our children the same thing.
Well, thank you. Thank you, Shavon, Arline-Bradley, Dr. Angela Marshall, Dr. Georges Benjamin, very much. Before I let you all go, I just want to mention a couple things. Again, thank you all, viewers. Sorry we couldn't get to all of your questions, but we can answer them, we can capture them, and we can get back to you. You will find many answers to your questions on our website, BWHI.org. I want to thank you for joining us and invite you to join us next Friday at 4 p.m. Eastern Time, when we'll discuss what exactly being at high risk means. We're going to bring a number of experts in wellness, emergency medicine, and technology in to talk about what being at risk means. And just to remind you, this episode and all episodes can be found on our website. So you can watch them. Please share them with your friends. Let us know what you think about this. If you've got good information, what else we could do, what else we could add. Again, coronavirus.bwhi.org is where you can find resources and tools and strategies for dealing with this. And before I let you all go, I just wanted to echo what's been said. These are really difficult and scary times. And we hear every day, many, many times a day, this notion of social isolation. And so what I want to do is offer something. We may have to be physically isolated, but as I said, let's not be socially isolated. Check on your friends, check on your relatives, check on your neighbors. Do it via video, put an eyeball on them. Black women are very good at saying, oh, I'm just fine, when they're really not fine, because they're juggling parents, a job, children, the stresses of COVID-19, dealing with friends who have passed away. I just talked to someone today whose 50-year-old friend was found dead in her home, likely COVID-19. Put an eye on them, look at her, look at your sister, look at your best friend, look at your mother and say, you know what, you don't look like you say you feel. Let people know you care. Let others know that they're important to you, and they will let you know that same thing. It's important now, with this physical distancing and with the stresses of COVID-19, for us to be as connected as we possibly can. And that means reaching out, calling people, seeing them, and letting them know how important they are. The Black Women's Health Imperative has been here for Black women for 37 years. We are here for you now, and we intend to honor that commitment and that promise. So until next week, please take care of yourself, take care of others, get a break from the news if you can, and join us next week when we continue